I have tried to be a different doctor. I think the most important part of my care is communication. So all my patients have my cell phone number. After thousands of deliveries and having done over 200,000 in-person visits, I realize our healthcare system, women, is broken. It's a national crisis. Our national cesarean section rate has increased more than 50% compared to 30 years ago. Maternal mortality rate continues to rise, particularly for women of color. And of course, there is the reversal of Roe versus Wade. I want to share with you my thoughts as to why this is the case. Reason number one, women face higher health costs. On average, women will menstruate 40 years during their lifespan. Think about all the problems adolescents have with menstrual irregularities. Then you have reproductive years, and then menopause and beyond. And let's talk about all the preventive measures we do with women, starting with Pap test once one turns over 21. And then we have mammograms as of 40. Women, compared to men, are more likely to suffer from certain chronic conditions such as fibromyalgia. And then you have depression, where women are affected twice as often. All this means women are more likely to be on prescription medications. So here lies the problem. Compared to men, women's wage is only 83 cents on a dollar. This gap used to be 61 cents in 1960, and the gap is narrowing, but the progress has stalled in recent years. So on one hand, during women's lifespan, more money is spent on healthcare, yet earning much less. Put differently, women will have to work extra 40 days to earn a similar wage. Reason number two, we lack national paid maternity leave. The US is one of 7 countries worldwide where we don't have such a plan. I think the most important part of pregnancy is not the 9 months, but postpartum. It is the postpartum period where new mom bonds with her newborn, and the whole entire family will learn to adapt. I don't think the postpartum period is 6 weeks. It may be longer than 6 months. It may even be a year. But think about new mom. Rather than learning to be a parent, she's thinking about going back to work because there is no paid maternity leave. As an employer, I do not want my employee to come back sooner than when she's ready. She's going to be at risk for mental health conditions such as anxiety and depression. She may not be recovered fully from her cesarean section. So she's not going to be 100% productive, which means our workforce as a nation is going to be affected. Here's reason number 3. Our politicians are undermining women's health care. In a country where more than half are women, only 27% in the Congress are made of women. If you look at all the elected offices in this country, only 1 out of 3. Think about that. Think about that gap. Now, let's use the reversal of Roe versus Wade. That is just not a health issue. What we are saying is women are not equal to men. You don't have control over your body. Your bodily autonomy is being taken away. A big consequence, for example, take half the training spots for OBGYNs in this country. The procedure involved in abortion will not be offered. So what's the consequence? We have 4.5 million confirmed pregnancies where little under a million pregnancies will end up in miscarriage. The procedure we use for miscarriage is the same as the abortion. And yes, one could bleed to death with miscarriage. What half the new doctors are not going to be trained in such procedure. So who pays the price? You do. Why? Because of our politicians. You are not being represented well. Reason number 4, women are under-researched, underdiagnosed, and undertreated. Differences between men and women are not accurately reflected in modern medicine. Even in animal studies, it still favors male biology. So what's the problem? Women are more likely to suffer from chronic conditions. Let's take autoimmune disorder. 78% are women. Women are 3 times more likely to suffer from rheumatoid arthritis, 4 times more likely with multiple sclerosis, and 78% of Alzheimer's patients are women. Chronic conditions such as fibromyalgia, chronic fatigue syndrome, and chronic Lyme disease affect women more than men. And that certainly is the case with mental health conditions such as depression and anxiety. And then there is heart attack. Women are not likely to present with classic heart attack symptoms because those studies were done by men with mostly male subjects. So there's a delay. On average, 7 to 10 years delay in diagnosis of heart disease for women. During those years, other chronic conditions will set in, a huge problem. In 1977, the FDA said, you know what? We should really leave out women in the reproductive age group to really protect vulnerable population. This happened because during 1950s and 60s, many developed countries used thalidomide, which was used for morning sickness and anxiety. Unfortunately, this turned out to be one of the biggest disaster, tens of thousands of babies born with birth defects. As a knee-jerk reaction, women were left out. Drug companies said, yay, because if we're gonna include women, we need more of them because they have menstrual cycles and hormonal variations. Therefore, more women subjects are needed. And also the thought was, what works for men should work for women. Guess what? That isn't the case. So in recent decades, most medications which were taken off the market was because of side effects suffered by women. Now, in 1997, the FDA said, well, we should really include women as part of a study, so any new drug coming out should have a safety profile based on race, age, and the gender. But the gap is yet to be narrowed completely. For men with ED or erectile dysfunction, our options are pills. Yes, when it first came out, it was expensive, but now I don't even have to go see a doctor. I can get it online. I can get it shipped for a few dollars, and I can take it as often as I want. Now, for women, let's talk about Vyleesi. It was approved in 2019. First of all, it's not a pill, but it's an injection. At least 45 minutes before your planned intimacy, one needs to give that injection. And you can only do it once a day and no more than 8 times a month. Now here's the kicker. It costs over $700. It's not affordable. Most American isn't going to spend $700 just to please her partner or to engage in intimacy. Now, why the difference? I think this is a good reflection of where clinical researchers are, that recent clinical trials have not included women. We have a long way to go. Reason number 5 is drug companies. We are familiar with that Sackler family, which is responsible for OxyContin. Many of you may not know that the same family is also responsible for Valium and Librium usage many years ago. Arthur Sackler many years ago started this trend where drug reps were going into doctors' offices to entice them to write prescriptions. And unfortunately, the US and New Zealand are only 2 developed countries where drug companies may market directly to consumers with prescription drugs. The rule was relaxed in 1997, and this trend has not stopped. Here is the problem with direct marketing. First, the FDA cannot limit the amount of money being spent, and drugs which are being marketed, if it happens to have serious side effects, that cannot be banned. And drug companies do not have to tell you how each medication works. They don't have to tell you how much it costs, and they don't have to tell you about alternatives, which means drug companies can raise price all they want. Past few years during pandemic, Pfizer and Moderna have made so much money. It is said they make about $100,000 in profit every hour. Now, let's talk about a medication I just saw. It's called Nurtec, a medication for migraine headache. When I saw the commercial, a well-known influencer comes on and says how she's been suffering from migraine and how this new medication has just changed her life, all in 20 seconds. And I looked into this medication. The data which was used to approve this medication involved little under 4,000 people. The control group reported 58.6% pain-free after 2 hours of taking the medication. The placebo group reported pain-free, and that number was 44.6%. So I'm thinking, little over half who took the medication reported relief, and little under half of people who took placebo reported relief. Little over half, little under half. This type of marketing is everywhere. You know, the amount of money we spend on prescription drugs is 17% of our total medical care expenditure. That amount is so large that if it was a country, it would be the 23rd wealthiest country in the world. Here's the last reason why women's healthcare is f***ed up. Shortage of OBGYNs. As of right now, 9,000 nationally, and this number will increase to 22,500 come year 2050. This will particularly affect rural areas where more than half will have to travel good distance for any kind of health care. More than half the counties in this country do not have a single OBGYN. And it is not just rural areas. Take cities like Dallas, Detroit, Los Angeles, Miami, St. Louis, all in the same boat. So what's the problem? It's a simple answer, supply and demand. In recent years, number of women over the age of 18 grew by 33 million. At the same time, the number of new training spots for OBGYN grew by less than 200. The average age of OBGYN is 50. And since it is one of the lowest surgical specialties when it comes to compensation, we are having a hard time attracting new young doctors. It also has one of the highest rate of malpractice rates and one of the highest rates of burnouts. So are we in trouble? We are in deep trouble because training a new OBGYN is not a simple task. It's 12 years of education and training after high school. After that, I think it takes 5 to 10 years for young doctor to gain experience to practice with some sort of confidence and comfort. We're talking about 20 years. How do we replenish this number? Unfortunately, I don't see American College of OBGYN or American Medical Association or our government doing anything about that. This is not a major issue. Yes, we are in trouble. So, what can you do with our broken healthcare system? How can you take control over your life, your health? Here are my thoughts. First, get healthier mentally and physically. You know, I think everyone should have a scale, blood pressure cuff, and glucometer. I think self-monitoring is so crucial. What happens at home is more reflective of what's going on with you than one simple number in my office when it comes to blood pressure or weight. Self-monitoring really is more valuable than any test that I can recommend. Same thing goes for food diary. As we get older, we really need to mind what we eat. In my generation, for sure, we have not been taught well as to how to eat. As I'm getting older, I realize I never really ate well, and I'm eating well now. So that's what we need to do. Document our food, our exercise, our thoughts. My recommendation for you is really get a notebook and get a pencil. Jot down all these in your own handwriting. It slows you down. Strongly recommend that simple task is going to be helpful. Secondly, find good doctors, especially primary care physicians and OBGYNs. OBGYNs play a very critical role throughout women's life, from adolescent to menopause and beyond. Having a good relationship with your OBGYN is so crucial, not just for prenatal care, but for many years after that. Things I look for when I recommend doctors, especially with the primary care doctor and OBGYNs. First of all, the ones I recommend are good people, but I know that they have great bedside manner. Find doctors who you know you can communicate with. And this may take a trial and error, especially trying to find a doctor you can connect with to really address your psychosocial issues. It's not one visit. It may be a few visits, which means you may have to jump around. But take your time until you find one where you can connect with. It's all about communication. Third, speak up. Remember I told you only 27% of Congress is made up by women and only 1/3 in all elected offices? We need more women who will represent you. And we all need to vote and vote for the right person and the right cause. My fourth advice, before jumping on pills, try natural supplements. Consider this. What if you could find a natural substance that has the potential to support your overall health and well-being on a cellular level to affect real positive change in the way your brain, body functions? And what if that substance was safe enough for everyone, regardless of pre-existing conditions? It really sounds too good to be true, yet there is such a substance found in nature, identified and studied by scientists. We call it cannabidiol, and its simple name is CBD. Once I discovered CBD, I knew exactly what I had to do. This amazing natural substance can replace many medications and can help many women. And I have been serving women for 30 some years now. But now I want to serve you.